Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning into the Tate Chronicles. Join me as we explore the leading edge of healthcare delivery and technology. Really pleased, I don't want to say old friend, but a longtime friend, personally, as well as to the show, Bevey Miner, the Executive Vice President for Healthcare Strategy and Policy at Consensus Cloud Solutions. This is the company that really started the interoperable digital cloud faxing solution over 25 years ago. It's grown to be the global leader in digital cloud fax technology, as well as a lot of solutions that are desperately needed right now. Bevey, welcome to the Tate Chronicles.
Thank you. It's always a pleasure. And I missed you over the last year or so.
Yeah. I was at HIMSS last year. You probably were. I'm going to be there this year. I bet you're going to be there too.
Yeah.
But let's talk first about the first conference that's coming up, which is VIVE 2026. That conference is going to be in Los Angeles. I know you're going to be there.
Yeah.
And I think the overall theme is invest where the future is being built. Not totally sure what that means. Maybe you can explain it. And how does consensus fit into that theme? And what are people going to find at your booth this year?
Yeah, what's interesting is that when you really think about data sharing and you think about the ways we are trying to advance interoperability, when you look at cloud fax, digital cloud fax, it is the most efficient and the widest used for send and receive. Send and receive all day long. You can send a fax, you can receive a cloud fax. It's high trust certified, and it's very easy to do. CMS identifies interoperability as send, receive, find, and integrate. The find piece has always been a challenge when you're dealing with unstructured data, that even in send and receive for a digital cloud faxing solution, you can't find. So a couple of years ago, Consensus recognized this and said, we have got to make these faxes intelligent. We have to make them usable, and we have to make them smart. So we set out to say, can we extract data from these faxes and make it structured data so that it is not just a picture? And if we can do that, what are the possibilities? In the last few years, the industry has almost created an open, runway for us to be able to show the use cases of why that's so important and valuable. Because that lockdown data could have a concerning lab result in it. It could have some information that is so critical for research or for population health. And it's just sitting in this pile of lockdown data. Now, what's also interesting is if you look at the AI companies that are out today, the ones that are getting valuations in the billions and venture capital money in the hundreds of millions, is they're AI technologies that are either generative, they are prompt question AI technologies, they're prior authorization or population health or workflow tools that are being driven and fired up by AI. But they have to start with structured data to do their magic. So you have to be able to unlock all that information in order for a prior authorization or population health or revenue cycle management solution to really be able to do what the AI needs it to do. That's really where our sweet spot is in the AI world, is to make that data efficient, actionable, find it, be able to have it mapped so that you're not having to go out to separate workflows. And we have found tremendous traction for the stuff that a lot of companies don't want to touch. You'll hear them say, oh yeah, we have an OCR solution. Because you have to you have to go to market with some way to extract data. We have an OCR solution. When any workflow is added to our magic, we really make that data usable and functionable, because that's what we've started with. Is we've got billions and billions of pages of faxes that go through our platform every year. So we know that there's a plethora of that unstructured data that is in a picture. And that's where we've been able to really have a unique offering in the marketplace to say, I don't care what AI you're starting with. I don't care what kind of workflow tools you have. You have to have really sophisticated, unstructured data models that actually create from unstructured to a structured data, and have the confidence that that data that is being extracted from that unstructured data is actually the data that you want to see. So, and there's a source of truth, Jim. That's what's also very different about our AI offering, is we're not generating something that you can't go back and find an actual document or a source of truth. Our offering does have generative capabilities and prompt questions, because now that you've got all that data structured,
Yes.
you can ask the AI, well, now give me, anything that might be concerning or trending, or find within my patient roster all these patients that I want to do some population health on. The patient that's 68 years old with chronic conditions that's been utilizing our system at this level. Once that data is structured now, you've got the capability to have generative AI results by asking a lot of prompt questions.
Usually when we've talked about or attempted to define interoperability, kind of one of the common terms or phrases is the right data at the right place at the right time. And that is involved with making treatment decisions. But the concept of all this petri dish of data that is out there, locked up in unstructured data, in hard documents, or whatever, there's been a kind of a dream wish. If that could somehow, we could reach our arms around it, the research capabilities of access to that data would be phenomenal if we knew what to do with it. With AI, we know that AI could be unleashed on that if all that stuff from whether it's 10 years ago or 30 years ago could be clawed back. And so is that an area that Consensus is working on or is capable of or is thinking about?
Yeah, I mean, when you think about the uses of data, he who holds data in healthcare is king, right?
Mm-hmm.
And when we look at those kinds of companies that archive data, that do data cleansing, for instance, they are sitting on a pile of really important data, but it's not data that can be found. It's not data that is structured. So it's archived. We have to archive data in healthcare.
Sure.
But think of the possibilities if all that data were now structured in such a way that we can do comparative effectiveness research. We can look at treatments from a while ago that actually may have solved a problem with a patient or treated a patient that's buried because we don't realize that treatment combined with this medication, combined with this lifestyle change, combined with this food altering way a patient lived their lives, that really was making a huge difference and creating the best outcome for patients. Because that data 30 years ago, 20 years ago, all that data is unstructured data.
Right.
Right. So
Yeah.
when we combine it into big population health or research capabilities, now we have data that can transcend through time. And there's a wealth of information, because we look at, why are people getting sicker? Why are we ending up with more chronic conditions? Why are we ending up with comorbidities? Why do we have obesity at the levels that we have obesity? And there's some common logical things where people aren't eating right.
Sure.
But if we can go back and we can look at points in time where the same type of patient, the same archetype of patient was living a healthier life,
Yes.
we can find out a lot.
And zip codes, geographically.
Yes.
I mean, just so much, it's population health, but you suddenly have a much larger data field to run across.
Yeah, what's interesting
yeah.
about that, not to interrupt you, but if I
No.
don't complete my thought, sometimes I go, it was fleeting.
Me too, yeah.
Right? Is that when you think about population health and you think about research and making sure it's really inclusionary, where a lot of this data is that's sitting in unstructured formats is in those care settings that treat our most vulnerable patient population. Those care settings that are rural health, those care settings where we have some of our most expensive patients that utilize our system, and they don't automatically have ways of sharing structured data. They haven't moved towards a FHIR-enabled system. Many of them are not on EHRs, let alone certified EHRs. And if we don't make an effort to unlock all of that data, and we only go with data for research that is coming out of academic medical centers, for instance, the data is naturally biased. It's just not including everyone with a certain condition in order to be able to do that deep research.
Well, it's not only the right thing to do, it's the best thing to do from health outcome standpoint, the more data. And you're right. Where that data is locked up, finding what stones to turn over. But again, the power of AI to analyze and ask questions that we're not even asking to come up with new information is really an exciting time. It's not only the right thing to do, it's the best thing to do. Not often that those two things kind of come together. One thing you and I mentioned earlier is all the healthcare data that insurance companies have, that Medicare has, diagnoses, where
Right.
people live, what medications have been prescribed, how much longer they lived, radiographic reports, all that kind of stuff. It's pretty exciting times. Let's get back to Vive for just a minute. Unfortunately, I'm not going to be at Vive, but I'll see you at HIMSS. But at your booth, I think booth is 1918. It's easy to remember. What are you going to be showing there? What's going to be demonstrated?
So the way we're going to Vive and the way we're going to HIMSS is we really want to elevate the eFax brand. And the reason we're elevating the eFax brand is because so much of the focus of where we're headed with a lot of our policy work right now, the CMS aligned networks, the focus on TEFCA,
right.
The focus on the latest new proposed rules that just came out for certifications. That focus is all about embracing structured data and embracing FHIR and embracing FHIR resources and FHIR technology. And it's creating this screen about acts the facts, about, and we know we have to get off paper, and we know we need to take an axe to a fax machine. We need to get rid of fax machine. They are the most inefficient way we can possibly send patient information is a fax machine. But what's starting to happen with that is this Axe the Fax campaign is picking up digital cloud fax, is picking up the way we send and receive unstructured data. And with the amount of data that is being sent and received via cloud fax technologies, it's not going away. It's not going to go away. Go back to the underserved market. Are we going to all of a sudden now give all of those providers that were carved out during meaningful use, during when ACA was put in place to go buy an electronic health record, and CMS carved them all out, the substance abuse clinics, behavioral health, the birthing center, the community clinic, they're not going to be able to afford to put in the kind of technology to all of a sudden have structured data flowing. And this idea that we need to axe the facts in every instance, and then starting tomorrow, as we create these new rules and this new standard, which is a perfect direction to go. Don't get me wrong. I'm not, suppressing the inertia and the momentum. I don't want to suppress that of TEFCA and FHIR and the CMS aligned networks. But we have to recognize that fax is not the problem. Digital cloud fax is not the problem. It's what we do with it. It's how we extract the data, how we make sure that it is efficient, and that the underserved market, the substance abuse clinic, can still receive a fax or a fax referral coming from the acute care setting. And when companies like Consensus get in the middle, we can make that data structured. We can make it FHIR enabled, so it can go back to the larger hospital system, and the underserved market just keeps doing what they're doing. So we meet them where their digital maturity is, which is not in a connected ecosystem that is running on FHIR right now. And that's the message that we're going to show at Vive. And that's the message that we're going to show at HIMSS. So you're going to see a resurgence of a technology that everybody thinks is legacy, old, should go away, and is in the F word in healthcare. Because that's not going to happen. We're going to put our heads in the sand if we honestly think that tomorrow every provider is going to be able to adopt the new standards. And it will happen. It will happen over time. And it's going to happen through things like the Rural Health Transformation Program money that's going into rural health, that the federal government, $50 billion, is going into rural health to help alleviate some of the headwinds of the cutbacks for Medicaid. But it's not going to happen overnight, and we are going to prevent a lot of the underserved market from being able to have the kind of information and send the information that they need to send today. And that's what you'll see at Vive and HIMSS, is how does this digital cloud fax technology fit into this system, and why it's important to recognize it.
You mentioned the changing certification standards, and there were some executive orders in 2025 that really changed some of the certification stuff. Demographics got changed. Some of the requirements to maintain certification, real world testing, things like that got modified. But one thing that was not dialed down at all was interoperability. The real world testing still has to be done on the FHIR servers and things like that. And that commitment really has been shown to be just as strong, if not even stronger, going forward from the federal government towards interoperability. But like you say, there are a lot of factors, a lot of third parties trying to do interoperability solutions. And it's not going to happen overnight. Some parts of it, switch can be flipped, but just the culture thing of a provider turning on a TEFCA cable and learning, or when to trust, how to trust that data, where the data is really coming from. It's going to be fascinating to me to see, the emotional, cultural side of things roll out. Kind of just the trust.
Yeah, well, the trust is starting to get bad media coverage right now.
Is it? Yeah.
With Epic's lawsuits, and Epic really saying that that when you look at data sharing, and you look at data sharing underneath the TEFCA guidelines, it is for treatment purposes. That's how you query, is for treatment purposes. And there have been a couple of violations for that, whereas a few companies that had the capability of querying data were querying data, but then the data would end up in the hands of law firms that were working on class action lawsuits for certain kinds of health conditions or treatments or something like that.
Okay.
And law firms, today they just have to do advertisements that say, were you taking this medication? And you see them on TV, you might get, some sort of a letter or an ad that will pop up. It's very hard for the law firms to find as many people as they possibly can that were on a particular medication or something like that. So the law firms pay very handsomely to try and get patient data that will show that a patient was on a particular medication or taking a combination of something. And there's been, a screen against where's the data going that's really being queried. Is there, a false pretense that it's for treatment and it is leaking somewhere else? Now, I'm not going to take one side or the other of all the lawsuits, but Epic is keeping a very, very close eye on this because they really are leading the charge for TEFCA. and they have been leading the charge for TEFCA. Their QHIN, I think it was 2 years ago, they came out and said that if you want to be a trading partner with an Epic physician, you have to join TEFCA. You have to sign the legal agreement by the end of last year. And trust, it's a trusted framework, is TEFCA. That's what
Yes.
that legal document is. You're signing a trusted document that says, here's how I will use this data. If you erode that trust in TEFCA,
Mm-hmm.
then there's
Mm-hmm.
going to be a lot of eyebrows raised that say, where is all this data really going?
So, that's a sign of trust. I've never thought about that. The trust around security. I was kind of thinking more around trust. Do I just trust in somebody else's data if I'm the provider?
Yeah, and where that data goes and
Wow.
how it's shared. Once you
Wow.
create an ability to just look through a lens and be able to see all this PHI, we
Yes.
have to be very careful on where does that data really
Wow.
go.
Yeah.
And the other interesting thing about it is the CMS aligned networks are what this administration has introduced.
Mm-hmm.
And there's a lot of people that are saying, well, what's the difference between TEFCA and the CMS aligned networks? And I've heard some conversations that say, well, this looks like a competition. I mean, this is like, who best man win.
Yeah.
But there's room for both. There really, really is, because a lot of vendors put their hat in the ring that were not QHINs to pledge to the CMS aligned networks. But there's still that same trusted, where does this data go and how does that data remain secure? That patient data remains secure. And even if you cross over to generative AI, where new data is being created and put into the generative AI, platform. So every time there's research done, it learns and learns and learns more, but it's learning off of real patient data.
Sure.
As more and more and more of that data. So the big controversy with AI is, how do you keep that data secure? I mean, there could be a lot of nefarious uses
Absolutely.
of that data.
Tell me this, you've been to many conferences. Is there anything in particular you're interested in checking out at Vive this month, or particular partners you're going to be interacting with? What are you looking forward to?
Thanks for that question. I think I answered this last year too. When AI first entered the scene 3 years ago, and I'm talking about 2025, it was Microsoft and Epic that kind of came out with this announcement that said, we're going to generate AI based on a lot of these prompt questions. And we all thought that was the silliest thing. You're going to generate AI so doctors can treat a patient. And I'm saying we all, the industry was like aghast. We were, how is that ever going to work?
Yeah.
Then go another year for HIMSS or Vive. And it was like, ask health systems, are you investing in AI? Kind of, maybe. We're looking at it. 10% we're going to invest. We're putting together an AI strategy. And then 3 years, which is last year, AI had real specific use cases. I have never seen a technology looking for a problem to solve move as fast as AI has in this industry.
Mm-hmm.
When there was such an inquisitive, how is this really going to work 3 years ago?
Right.
And now today, it's like, look at the way it's working.
Exactly.
So I think what we're going to start to see at Vive and at HIMSS is those companies that can solve a lot of things with AI. Buyers today are really getting choked by point solutions that do this one. AI, I'm going to use this for agentic AI. I'm going to use this for ambient listening. I'm going to use this AI for my prior authorizations, this one for RCM. They're looking for companies that have a broader swath of what they can do and what they can offer. And we've got that kind of message. We show different kinds of use cases. So I'll be interested to see at Vive, because AI will be very prevalent. I mean, I was at Health, same thing at Health. If you didn't have AI in your booth, you
Right.
you were something wrong with you. Why are you exhibiting here? So I'll be looking and seeing how a lot of the vendors present themselves, and I'm pretty excited the way we are going to be presenting ourselves to say, look at all the things we can do with your unstructured data, and how that's going to start to really surface from a competitive standpoint when you start to see a lot of vendors with the same messages.
Bevy, before we run out of time, remind us what booth you're going to be at Vive.
1918.
1918. That's right.
Yeah.
That's right. And
I let our marketing people remind me all the time of where.
1918. I like that. And of course, more information about Consensus and the work and the blogs and all the information is at consensus.com. To our audience, thanks for joining me on this episode of Tate Chronicles today. I offer a special salute to my guests, Bevey Miner of Consensus. Bevey, thanks for coming aboard today.
Always a pleasure. Thanks again, Jim. Have a great day.
I enjoyed it. You can find more information on this show's program page at healthcarenowradio.com. That's healthcareradio.com. Until we meet again, here's wishing you smooth sailing and safe harbor.
Tate Chronicles transmission ending now.